Can you explain inflammation to me like I'm a 10-year-old?
Steve, you have an immune system that protects your body. And inflammation is when we turn that immune system on and we make it active. And sometimes that's a good thing, right? If you had a tummy bug, you want to clear that infection, right? If you hurt yourself, you want to heal that wound. That's when your immune system is really good. It's working for you. But the problem that we have these days is that we're turning on the immune system when we don't need to. And it's staying on 24 hours a day, 7 days a week. And that ultimately creates problems because it leads to new issues, new health conditions.
The word inflammation sounds like something has inflated or become swollen.
Yeah. That is a part of the process. For example, if you hurt your knee, right, there will be inflammation in your knee and it will get red, it will get swollen, it will become tender. And like those are the typical characteristics of inflammation when it arrives. But what we're talking about is chronic low-grade inflammation. And this is a tricky thing because it can fly below the radar. It can fly below the radar where you don't realize that it's there. Your doctor may not realize that it's there. And it manifests in these subtle ways where it's like you have increased fatigue, you have difficulty concentrating, you don't sleep well at night, you wake up with aches and pains, or you have joints that hurt a little bit, or you've had skin issues, right? And it's like, well, we all have those problems. But that's inflammation. Inflammation is driving many of those issues. And so it's important for people to be aware that, you may like there's so many patients that go to their doctor complaining of these symptoms and the doctor's kind of not really sure what to do about that. And I think it's time for us to open our mind and bring awareness to the possibility that there is this issue, inflammation, that's driving that problem, the symptoms, the health conditions of which there are many. And ultimately we need a plan to address that.
And can you be skinny and in shape and still have inflammation?